Hip injuries and disorders. Introduction. A bursa is a small fluid-filled sac that acts like a cushion between a bone and other moving body parts. Select true or false. Correct. A bursa is a small fluid-filled sac that acts like a cushion between a bone and other moving body parts, such as muscles, tendons, or skin. They are lined with synovial membranes. Todd is 70 years old. He fell this morning and is now having trouble walking and moving his leg. He also has pain in his thigh and groin. Should Todd contact his healthcare provider? Select yes or no. Correct. Todd should contact his healthcare provider right away. Trauma to the hip may cause hip dislocation. Select true or false. Correct. The hip can be injured in many ways. These include sprains, fractures, and dislocations. These may be caused by a fall from a height or trauma to the hip. A dislocated joint is a medical emergency. Select true or false. Correct. If you think you may have one, seek medical attention right away. Bursitis happens when one of your bursae becomes inflamed. Select true or false. Correct. Bursae are found throughout your body, including the hip. Bursitis happens when one of your bursae becomes inflamed. Arthritis symptoms can usually be controlled with medicine. Select true or false. Correct. Arthritis can be controlled with various medicines that decrease inflammation in the body. Other treatments are also available. Having a history of joint injuries is a risk factor for avascular necrosis. Select true or false. Correct. No one is sure what causes avascular necrosis, but having a history of joint injuries is a risk factor. Thank you for using Explain.